first of all, welcome from me. I am Kay Fawcett. I'm the chair of the Advanced Practice Independent Steering Group, and I'm going to be facilitating today, along with two other colleagues here, Paula McLaren, who you'll hear from, and also Aditi Chowdhury Gandhi, who's also online with us. So welcome both of you, and thank you very much. I'm also ably supported by a number of other people in the team who will be sitting in the background supporting with any information that we need to move forward with. Thank you. So we are expecting a couple of hundred people to be on the webinar today, and so because of that, everyone except us as presenters will be automatically muted, and we won't be using the raise your hand feature for questions. But please do feel free to use the Q&A function for any questions and comments. What we'll attempt to do is answer lots of questions while we're online here. But due to the numbers attending, what we will do is, if we can't answer questions now, we'll follow it up with the frequently asked questions. And because, as I've said, we will be recording this session, it'll also get uploaded to the AP website after the session. If you need to, for accessibility, you can switch on live captions to assist you with the session. And any further questions and comments that go after the meeting can be emailed to the email below there, advancedpractice@nmc-uk.org. So what we're going to cover this afternoon, we're obviously delighted to see so many people here, and also to be able to talk about the launch of the Advanced Practice Principles, which are the beginning of the work that we're doing towards advanced practice regulation. So what we'll cover today is why it's important, and how we went about developing the principles, what the purposes of the principles and the structures of them, talking about definitions of advanced practice and what that means for employer organisations, and then a little bit about how to implement the principles, conversation about early adopters, and then on to questions and answers. So hopefully that should give you quite a lot to do in the next hour that we've got. It's a very full session. So just to start off with talking about the purpose of this work. So I became the chair for Advanced Practice about 18 months ago now. And the idea really was to look at a regulatory process for advanced practice. And the NMC is working on this piece of work to establish a robust multi-phase regulatory framework that will give public protection, promote consistency across advanced practice across all sectors, and build confidence in advanced practice professionals across all the 4 UK nations. So this is an England, Wales, Northern Ireland and Scotland initiative. We work across the 4 as the Nursing and Midwifery Council. The purpose of the work is really to improve the regulatory oversight of a growing workforce of nurses and midwives working at an advanced practice level across the UK, making sure that those people are safe, effective and publicly accountable for practice, but also to give them some consistency for themselves whilst they're practicing with their initial registration, and then thinking about them working at the top end of their registration. So the current issues that we're looking at are integrity of the register. The NMC doesn't at the moment know which registrants are practicing at an advanced practice level, and members of the public can't easily identify them on the register. We've also got inconsistent standards, so there's significant variation in the way that advanced practice is defined and implemented and governed across the 4 UK nations and sectors. We've then got protection risk. An independent research by the Nuffield Trust completed with an internal analysis in 23-24 found latent risks to public safety because of the absence of standardised regulation for AP roles, and there was no single solution. So the Council recognised in March 2024 that multiple regulatory tools are needed to address these risks. A multi-pronged strategy is really essential to what we do. I'm now going to hand over to Aditi. Thank you.
Thank you, Kay. That was really helpful context. So To move on to the points about the last point that Kay made was that there is no single solution. This is a complex, multifaceted problem. We recognize that. And we as a professional regulator have a part to play in this really complex regulatory landscape that exists. So what we are really aiming for is a multi-part solution. So the principles that were launched on the 10th of June, that was last week, really are part one of several parts that we are going to deliver. And only after we have concluded and delivered all of those different parts of the puzzle, really, that we can say we have delivered fully on the point of additional regulation of advanced practice. So you'll see that the upcoming work on the horizon really is the AP considerations for within the code and revalidation review. So as some of you will know, we have embarked upon the review of our code of conduct, which is now 10 years old, and our revalidation approach as well. We are going to embed what specific things we might want to consider and include as part of both those reviews and make sure that the AP strand is included within both of those. The third piece of work that is still ongoing and which started last year was thinking about transition and what are some of the things we need to consider in order to develop an approach that is proportionate, that is fair, and it's inclusive, recognizing that the entry point to advanced practice really can be quite variable. Some people have a more educational pathway. Some people might have had a more experiential pathway into advanced practice. So we want to make sure that any approach that we develop recognizes that actually you could be an advanced practitioner and have entered the world of advanced practice through numerous pathways. So we want to recognize all of that. And then the fourth and quite critical piece is going to be the standards of proficiency and associated program standards. Now, recognizing that we are looking at advanced practice across nursing and midwifery, two rather distinct professions with different journeys into advanced practice. So we've got to be very cognizant of the different issues that are there across the two professions, but also recognizing that there are some commonalities because ultimately we are looking at an advanced level of practice. Now, bearing that in mind, we've got to make sure that we develop proportionate program standards for those education providers that are delivering training for people who are wanting entry into the world of advanced practice. Again, a reminder for us is that the education providers may not be our conventional HEIs or what are NMC approved education institutions. They might be new and different kinds of providers as well. So all of that is going to be part of the considerations that we have as we progress all of this piece of work. And to provide some assurance to you, a reminder that this has undergone quite a rigorous governance process. So you'll see that we have our internal project board, which is our sounding board comprising of internal colleagues derived from different parts of the business within NMC to make sure that we have fully considered any potential unintended consequences of any aspects of this piece of work. We've also engaged quite fully at different points in time with a joint regulatory group. So this is a group of other professional regulators, but equally we have engaged with some of our systems regulators as well to make sure that any changes that we introduce are in line with some of the changes that they themselves had. Now, we had intended for these principles to also be joint principles. Although that has not happened, they are very much multi-professional in terms of their intent and scope. And the Joint Regulatory Group has helped us shape and work towards that ambition. Along with all of these internal groups, what we have got is a very vocal and very engaged public advisory group. And they have provided some excellent advice, particularly on development of the public definition of advanced practice and shaping these principles. And all of that information has been taken to our independent steering group. We just met them this morning to provide them with assurance in terms of how all of this is going to progress. They again comprise of experts from across the four countries that have been advising us and steering this important piece of work. And together, the recommendations they make are then taken to our internal executive board and then our council for approval. So that is how governance works within the NMC. And you'll see that these principles that were launched last week, they are out there on our website. So we do encourage you to please engage with them, raise the profile of this important piece of work. A lot of you have already been involved in this and have shaped this piece of work. So please do make them your own. In terms of what these principles are all about, so there are three distinct parts or three distinct groups that we have targeted these principles to. First and foremost, as Kay very rightly said in her part of the presentation, that this is about public protection. So we know that we want to make sure that the purpose of any additional regulation that we introduce is about providing that additional public assurance and enhancing public safety and public protection. So we hope that these principles will provide that much needed clarity on what good looks like from a regulatory perspective. We have tried to use language that is inclusive. We have tried to also include things that are important from a public perspective. And as I said, our public advisory group and the NMC Public Voice Forum have been absolutely pivotal in making sure we get this right. Along with that, of course, these principles are also intended for professionals themselves. So these include advanced level practitioners across nursing and midwifery who are already working at that level. But equally, we hope that this provides as a good ground for those who are seeking to become advanced level practitioners. So in a sense, it is about encouraging good practice and high quality, safe and effective care so that we can set clear expectations and build upon those when we develop standards in the future. And thirdly, and very importantly, we also want these principles to help support employers themselves because they play a dual role. They are not just employers, but they are also educators in a sense because they are supporting the supervision, the continued professional development, and also taking on the newer people or aspiring advanced practice professionals. So we are very aware of the critical role that employers can play in this puzzle, really. So we want to make sure that with these principles, you have an idea of some of the expectations from a regulatory perspective on what good systems of governance, for example, look like. What does it mean to have solid support and supervision for those who are working at an advanced level of practice? So we hope that that will help you design your own individual workforce plans, education plans, and your policies that meet your own specific requirements. Moving on now, so the three kind of areas, as I said, building on that, we have got something that is about governance. So you'll see that governance comes across quite loud and strong, particularly in the employer section. Now, this is in response to some of the feedback that we had received from all parts of our stakeholder groups, really. But we know that this is one of the areas that can be quite variable, and it is responsible for the variation that we see in the systems, and therefore the lack of assurance that sometimes the members of the public can feel. So ultimately, it is all about providing good governance so that we can support patient safety and public protection. And ultimately, it is about developing, sustaining, and growing advanced level practice and making sure that we can support multidisciplinary working. So yes, these are for nurses and midwives. As the professional regulator, we have developed, bearing in mind the professionals on our register, but we are very much minded of the multi-professional nature of advanced level of practice. So we want to make sure that the principles can actually shape some of that and provide wider benefits across the system and transform environments and care in which advanced level practitioners work. Now, a little word on how these principles were developed. As I said, a lot of you have been involved in this process from the get-go. So I'd like to extend a personal thank you to a lot of you because you have been engaging with us for the past 2 odd years. We are very grateful for all of those people who have helped us shape all of this piece of work. So that stakeholder engagement and that public engagement particularly, I would like to pull out, has been quite critical in developing a public-facing definition of what advanced practice looks like. But equally, in order to build a solid evidence base, what we have done is make sure that we look at what the international policy context is. What has been the approach, for example, of some of the external and other countries that have introduced or perhaps even not introduced advanced level practice? And what were the drivers? What were the barriers that they faced? What are some of the challenges they faced? And how have they approached the point of additional regulation? So we have tried to take lessons from all of that. Equally, we are minded that there are existing 4-country frameworks for advanced level practice. The scope is quite different for all of these. Some have a nursing only focus, some have a nursing and midwifery joint focus, and then there are some that are multidisciplinary in nature. So we are quite aware that the work that we are doing is not seeking to duplicate or replace any of that, but it's actually complementary to the existing 4-country frameworks. And with that in mind, we made sure that we looked at all of that. We've also looked at other professional frameworks and standards that exist to make sure that we are building on and complementing all of that piece of work. And along with that, of course, we've done extensive desktop research to make sure that the public protection strand is quite clear and we develop these principles in an evidence-based manner. So to remind you about the structure of the principles, there are 2 parts to the principles and they mirror each other. So we've got a section that is targeted towards individual professionals, or rather it is for individual professionals is how I would describe it. And then there is a section for employers. So in the individual professional section, you'll see that there are some clear expectations for nurses and midwives working at that level. And it really is trying to capture the fact that you could have APs working in a range of roles and settings. So it's not just about in the NHS, we also have advanced level practice in the independent and social sector. We know that there are several fields of practice, and often these individuals are working absolutely towards the edge of their scope of practice and are really pushing the boundaries and providing such value to the system. So it recognizes that actually it is that diversity of roles and settings that we must make sure is reflected. But at the same time, we are, again, quite minded that employers must support these individuals and professionals when they are working at an advanced level of practice. So we have tried to look at what is it that the employers can provide and what good looks like from a regulatory perspective. This has been developed, again, based on feedback that we received on the fact that continued professional development, clinical supervision, and things like leadership and multidisciplinary working are absolutely critical. Along with that, we know that governance and reporting systems and really the practical tools that can enhance and support advanced level practice are very much important. And that is fair and square, we think, with the employers. Now, that's why we've set really clear expectations. And you'll see that we've tried to span across the 4 pillars of advanced practice as they exist. So this is, again, a reminder of the fact that we've had really robust engagement over the past 1 year. And that really looks at the diversity, again, of stakeholders, but equally the diversity of individual professionals that work in the world of advanced practice. We have held a number of these webinars. We've also had quite a few one-to-one sessions, and we've had quite a few workforce conversations. So people working in the sector, but also employers, equally with educators and those who can shape and who are impacted by these principles. So essentially, this is very much a piece of co-production that we have got in front of you. And we're hoping that we will continue to work in the same vein as we embark on the next piece, which is about the code and revalidation. So now we have a little bit about how you can, this is a word cloud, so please try and tell us, those of you who have been involved in this piece of work, how would you describe our approach to engagement so far? How have you found it? And you can send multiple responses, but please tell us, because this will help us shape some of our future engagement as well. Excellent. I can see one response trickling in, so keep them going. Good to see the word inclusive. That has certainly been one of our biggest aims. Engaging, thorough, exceptional, comprehensive, encouraging, all really good words. I'm really grateful for that feedback. Very heartening to see a lot of you think we have been inclusive. To keep them going, we'll just keep it on for a few more seconds, and then I'm going to pass it over to Paula to take us through the next bit of the slides. Thank you very much. Over to you, Paula.
Thanks, Aditi. And yeah, thanks everyone for your thoughts on that. And it is really positive to see those positive responses, and particularly inclusive, because that's what we've absolutely tried to be. So my slide control is not working. Bear with me. There we go. So just to highlight the professional and public definitions that have been included in the principles, we set out with the vision of having a public only definition. And that was really because we thought if there was a definition which was clear to the public, it should be clear to professionals as well. But interestingly, well, not so, as you might expect, there are some nuances that professionals who are working at advanced level of practice wanted to see around complexity, managing risk, dealing with uncertainty, leadership. So we have ended up with two definitions within those principles, both of which have been shaped by our public advisory group and testing with members of the public, and the professional version, which was shaped by our professional stakeholders. So just another poll that you should see popping up on your screen now. Do you feel comfortable that the public definition can support conversations with people who use services? And interestingly, when we first shared the public definition with professionals, there's almost an instantaneous intake of breath. And then when people sit with it for a couple of minutes, they say, yeah, that actually, is how I explain the role that I'm doing to my patients. So the majority of you agree that it does support conversations that you're having, or that you have with people, your practitioners have with people who use services. Some of you are a little unsure, but reassuringly, only 3 people think it's not helpful. So that's really great. So thank you for sharing your thoughts on that as well. So we're going to get into the crux of the principles now, to hopefully give you a bit more support in how you can start to think about using the principles as an employer organisation, and aligning, as Aditi alluded to, your governance processes. And we've got some key questions that you might like to think about asking yourself as well. So we know that the principles set out our expectations for the effective that's required to ensure care and services are being delivered safely by nurses and midwives working at an advanced level of practice, and thinking about those things also around support and supervision, which is something that we heard throughout phase 1, that not everyone is having access to that support and supervision, but also thinking about professional development. And this is really to provide an environment where advanced practice can flourish and thrive. So just a brief overview of the principles for employer organisations, and as Aditi said, these principles mirror each other. So when there's a principle for individuals, there's a principle for employer organisation that sits alongside that. So thinking about the ongoing development of the advanced practice workforce, and we know through our conversations and through government plans that workforce is going to grow over the upcoming years. And thinking also about scope of practice and being really clear, but also being really clear about how professionals are working across the 4 pillars. Now, we're not saying that there has to be equal time spent in each of those pillars, but there does need to be thought given to how advanced practitioners are demonstrating that they are working in some shape or form across the 4 pillars. And that doesn't mean that everyone needs to be undertaking a primary research project or anything like that. But it does mean that there needs to be elements of those 4 pillars within their roles. So thinking about multi-professional, interprofessional working and learning, making sure that there is shared learning across organisations, across professional teams, having that open and honest culture, supporting reflective and reflexive practice. And I know that colleagues will agree that, you know, this is not surprising, but this is best practice, and some organizations will be meeting these principles, and some will have a bit of work to do in order to ensure that they are aligning with the principles. Also thinking about equity of opportunity, so thinking about access to advanced practice training and programs, but also in terms of practice opportunities as well. I suppose just a couple more to highlight on these. So clear lines of accountability and communication. How are you monitoring that workforce, and what kinds of things, what kind of mechanisms are in place, processes around reporting, monitoring and measuring risk, etc. So thinking about supervision, again, this was something that came out as particularly in some of the riskier areas that were identified in the Nuffield Trust report, thinking about primary care and out-of-hours services, that there wasn't always access to appropriate support and clinical or professional supervision. And really highlighting the leadership role of advanced practitioners in terms of thinking about innovation, making change, thinking about sustainability for the future, and demonstrating impact and value for those roles and that advanced level practice that is being delivered within your organisation. So how can the principles help you prepare for additional regulation? So it's an opportunity for a review of your current governance systems and arrangements, and thinking about how you're supporting advanced practice within your organisation. So as we've said, there will be some areas where you're absolutely meeting those principles of best practice, but there might also be areas for development. So developing, updating your governance mechanisms and processes. So thinking about assurance and auditing and reporting, as we said earlier, and also supporting conversations around workforce development for advanced practice. So thinking about growing that workforce and how these principles from us as a professional regulator can support those conversations. And also thinking about the leadership role, how we enhance leadership support for advanced practice roles where care is delivered. So the questions, just to help you think about what the principles mean for you. So what changes might you need to make for your organisation and your governance arrangements to align with our principles? Thinking about how you can support advanced level roles across different professions within your organisation. Again, thinking about the multi-professional team and that working and learning environment. How is that encouraged whilst maintaining those clear scopes of practice and accountability and reporting pathways? And thinking also about how advanced level practitioners are supported to work across the 4 pillars. Is that in place, and are you doing that well, or is there work to do there? And also thinking about what other strategies you could adopt to support advanced level practitioners work in alignment with the principles. So being mindful of those individual principles as well. And just a few more things to get you thinking about your organisation around advanced practice. How are you demonstrating the impact, as I said earlier, of the advanced practice workforce, thinking about improvements, benefits, and also value for money? Thinking about how the organisation ensures that appropriate support and supervision. So clinical and professional supervision for advanced level practitioners. So when they're in training, but also importantly, throughout the remainder of their careers. And how does the organisation support that equitable access to development of advanced level practitioner opportunities, as well as ongoing learning and development? And again, importantly, ensuring that advanced level practitioners remain competent and capable throughout their careers. So it isn't just about completing a master's in advanced practice. It is about demonstrating that that ongoing competence and capability, as I said, throughout their careers. And also, how are you ensuring public understanding of the role? And we have that public definition, but also what are you doing within your organisation to make sure that that people who use your services, people that you engage with, understand that role. So we also thought it's a good opportunity to think about some of the questions that we're asking individual practitioners to consider, but to also share that with you as a group of employers as well. So individuals thinking about how they are working in alignment with the principles and what might need to develop or change, whether they're working within a clearly defined scope of practice, which is relevant to their knowledge, to their skills, to their qualifications, and to their role. And do they have sufficient time within their role to work across the 4 pillars? And how do they demonstrate, particularly around the research pillar, and how is that supported within the organisation? So also asking them about the leadership that they're providing across those professional and organisational boundaries, and also thinking about innovation and leading quality improvement initiatives to improve services and care for people, but also to improve the systems in which they are working. So a few more questions for individuals thinking about that appropriate support and regular clinical professional supervision. Are they having regular appraisals? Do they have support for their revalidation processes, etc., etc.? So and thinking in line with that, I guess, about opportunities for reflective practice, but how they do that individually and also with others within the organisation. And also that equitable access, again, really making sure that they have equitable access to remain competent and capable through those ongoing learning, continuing professional development and training opportunities. And also thinking about their involvement in training the future workforce, and whether what support they have in place to allow them to be able to do that. And again, them individually thinking about the impact and value that they're bringing to the organisation. And this is about them being confident and able to use the principles to have conversations with you as employer organisations as well. So another poll, I think, is for you to participate in. So how prepared do you currently feel to implement the principles within your organisation? Again, it's positive to see that a lot of people feel somewhat prepared. There's a few that feel very prepared, which is really reassuring. I suppose we'd expect that you know, people are somewhere in the middle, feeling somewhat prepared. We recognise the principles have only just been published this week, and people are sitting with them and thinking about some of this stuff and how their organisation aligns to the principles. So on the whole, it's quite positive, I think. Some people are feeling very unprepared, but hopefully the conversations and the discussions that we're having today are going to help you. And of course, we're here to support as well. We're working very closely with other organisations around workforce across the 4 countries to think about how we work together and how they can support alignment with the principles as well. So what do we need from you? We need your support. We'd obviously like every organisation to start adopting, using the principles and aligning to the principles, making sure that everyone is aware that the NMC has published these principles for advanced practice. We're hoping that these principles are they're the first part of that puzzle that Aditi shared early on, but they are about supporting organisations to prepare for additional regulation when that arrives. So it is a good opportunity to start thinking about what's working well and what perhaps needs to be developed a little bit more. And also thinking about whether your organisation might like to become what we are calling an early adopter, but our steering group this morning suggested that an early advocate might be a better way of sharing that. But essentially, as I say, we would like all organisations to adopt the principles, but what we would like is to work with a small number of organisations which represent the kind of breadth and diversity across the sector and the settings, across health and social care, and across the 4 countries of the UK as well. So we'd like these early adopters to work with us over the next, provide feedback to us around what's going well, what's not going so well, what do you wish you knew at the beginning that you'd done differently. And there's a number of reasons for this, but it's really important that we are able to demonstrate the impact of the principles, and that impact will help us to shape the rest of the advanced practice review. So help us to shape those standards, that transition process, and also provide us with additional evidence for some of the potentially tricky or challenging areas that you're facing out there. And also for you as an early adopter to influence and encourage others to get involved with adopting the principles and preparing their organisations for additional regulation. We don't want this to be an onerous process, so we're in the early stages of figuring out what that should look like, but it will likely involve some touch points with us to have conversations or focus groups to give us that feedback. We'll also form a network or a community of practice, if that's the right word, where we'll bring the early adopters together. And for me, that's where the magic happens. That's where someone says, well, I'm having this challenge with this, and someone else says, yeah, we had that challenge and this is what we did and this is how we resolved it. At the end of all that, we'll evaluate and publish a report. And as I say, we hope that's helpful in encouraging others to engage with the principles. If you are interested in becoming an early adopter, then you can drop us an email for more information about that as well. So what does the future look like? So once we get to additional regulation, what we hope the future will look like is that there's clear expectations that enable the public to understand the role of an advanced level professional, nurse or midwife, what they know and what they're able to do. That employer organisations also understand our expectations and their roles and responsibilities in delivering advanced practice and supporting ongoing competence and capability of their advanced practice workforce. Advanced level nurses and midwives will be identifiable on the public register, and at the moment that looks like an annotation, but there are opportunities for what that might look like. But what we are clear about is that individuals are recognisable and identifiable on that public register. So, and also that in the future, Aditi talked about the education program standards. Education institutions will need to meet our standards for advanced as part of that ongoing quality assurance. So they'll need to be approved to deliver those advanced practice programs, and they'll need to engage with us to provide that ongoing assurance that they're meeting those standards. So those settings, health and social care settings, will have a clear understanding, as I said, of our expectation of best practice in governance for advanced level nurses and midwives. It'll also give us an opportunity to consider the themes and trends that may emerge from some of our fitness to practice data, which at the moment we have very little of, but we're beginning to capture some more of that. Also, advanced level practice will be explicit within the code, the updated code and the revalidation processes. Obviously, advanced level practitioners will demonstrate that they meet our standards, and that will either be through undertaking an approved program of study or have successfully transitioned through our transition process, whatever that looks like in the future. And this is all around, again, thinking about patient safety and public protection for those who are being cared for by advanced level nurses and midwives. So I'm going to skip on pretty quickly. This is our timeline for the review of advanced practice. So over the next 12 months, we'll be working on the we'll not be working on the principles. We've published those. We'll be working on the AP consideration as part of the review of revalidation in the code. We'll start to look at some of those transition or grandparenting options, as some of you might call them, and thinking about what that, what those options could potentially look like. And then in 2027, we'll begin work again on our standards of proficiency and associated education program standards. It's a big piece of work and it is going to take time. It's complex and complicated for the reasons that I've highlighted on this slide. It is a multi-professional environment. There are 4 country frameworks already in place, and we know that the workforce plans across the 4 countries are going to grow the advanced practice workforce. We know that internationally educated nurses and midwives face challenges when they come to work in the UK, and that's no different in the advanced practice space. So thinking about those things. Working with other organisations who are already credentialing and recognising and accrediting either programs or credentialing individuals through e-portfolios, etc. We also need to recognise that education institutions have already been through quite robust quality assurance processes. So we need to be mindful of that, and we always have to be proportionate in whatever response we take to the work that we're doing. I mentioned the multi-professional landscape, but even within our own 2 professions, there are complexities. Nursing is much further along in the journey to advanced practice than our midwifery colleagues. So we need to take that into consideration, and managing expectations that this isn't going to happen overnight. This has got to be a phased approach, as Aditi alluded to early on, and we really want to co-produce the products to make sure that we get it right for public protection and also for our professionals. And also just thinking about the specialisms. We are talking about an advanced level of practice, so that doesn't exclude anyone from the work we're doing. So we have got about 20 minutes for some questions from you. So I know that Aditi has got those ready for us.
Yes, thank you, Paula. People have been really active, so thank you very much for raising all your questions. I'm going to throw them straight at you. Some really, really good questions, actually, which will be beneficial for everyone to note. An easy one to start with. Someone's asked how they can nominate their organization to be part of early adoption or to be an early advocate, as we might be using. So,
yeah. So please do get in touch with us. On the last slide, you will see our email address, which is easy. It's advancedpractice@nmc-uk.org. But just reach out to us. We have some more information that we haven't been able to share in terms of the outline or plan or what that might look like. So just get in touch with us, and I'll get back in touch with you. So thank you.
Thanks for that, Paula. And then another question on implementation. Someone's asked if we are going to plan to monitor organizations for compliance to the principles, or are they intended for guidance only?
Yeah, so they are principles. They are not standards. We will go on to develop standards. We would like you to use these within your organization to prepare for those standards when they come. So this is an opportunity for you to start to think about that. We won't be monitoring compliance with the principles, no, but we hope that they're helpful. And what we've heard so far is that people feel that they are really helping them to prepare for additional regulation and have been really welcomed, haven't they?
Indeed. And I think people will be thinking about it alongside their revalidation in the interim period, in the intervening period while we're working on standards. So I think people will see this as something that provides some consistency in the period whilst we do the rest of the work.
Yeah, and it is the beginning. It's that we've always said the principles are the foundation for the rest of the work. So it's getting that bit right and then building on that. So yeah.
Thank you. Thank you. Yes. And another question that we have potentially had in the past, but it may be worth clarifying, once again, in that how do our principles, or how does this supersede potentially any other frameworks that might be out there already, such as the HEE framework or any other country framework? So how does that work with all of those frameworks?
Yeah, so the principles were not designed to replace any framework, particularly the four country frameworks. And we've worked really hard with, we've had 4 country working groups to make sure that that absolutely is the case. So they should align to and complement those 4 country frameworks. And similarly, some of the other frameworks that are in place. We've worked hard with organizations to really understand some of those other frameworks and as I say, to make sure they align and complement.
I think it's worth saying that we will continue to work with people that are developing work or reviewing advanced practice from their particular lens, so that we make sure that we work on that together as we go forward towards more standardized regulation. We'll continue to gather data, continue to gather information, and we particularly picked some of that up this morning related to education, for instance, and how educators can be part of this principles work.
Thank you. Another very interesting question on guidance for adapting or implementing the principles, but this is specifically for universities that might want to be interested in, implementing them. That is something that came up in our steering group discussion today, interestingly. So yeah, I'd welcome your comments on that.
I think one of the things that we had quite a lengthy discussion today in the steering group about how education and universities can be involved, and because adopting these principles seems the wrong word for them. But I think if we think about the advocate type of concept, the fact that they would advocate with the students that are working with them to think about how they adopt the principles, utilize them appropriately, and work with employers to do that. So that, again, it's about a set of standardized principles that everybody can work to. And I think that those universities and educational providers that we're on today were very keen to do some more work to think about how they can best do that alongside the work they're already doing with their quality assured programs.
Thank you for that. And that, I think, reflects the diversity point that we've stressed, isn't it? We do want to ensure that we reflect the diversity in which advanced practitioners work. So yes, absolutely, we will support everyone as far as we can, really. Another question, really clever question, actually, in that, are we to expect greater depth to the definition of advanced practice with the standards and proficiencies which will be set against the programs that are approved? So will we enhance in any way the definition that we have now drafted once we've got the proficiencies and program standards?
I think it's quite hard to say, actually, where we are at the moment. We're at the very beginning of this. So we're starting with a benchmark, which we may have to move.
Yeah.
But at the moment, we're adopting something that gives people a standard definition to work to. I think my view would be if we weren't doing this work on the principles and we weren't advocating people engaging more, I think you could say it was the final thing. I think we've got time to do this. We've got time to take soundings. And as a result, we may see some of these elements changing over time. That's a good thing, because it actually means that whatever we do will be as realistic and as embedded in what's really happening in practice and what's really happening for employers, rather than the NMC presuming that it knows everything about what's needed. I think we said right at the beginning, we do not know the full extent of advanced practice at the moment. And this is really part of us learning and engaging.
And that actually leads me to a question that people have asked in terms of how we would actually identify people who are working at an advanced level practice or who may be using the title advanced practitioner. Is there a way in which we will identify them?
So I think when we get to develop the standards of proficiency, we'll need to engage, discuss, debate, consult on what those standards need to look like. So, you know, I talked about that advanced level and being included. There may be some clinical nurse specialists who can demonstrate when we develop those standards that they meet those standards of proficiency. So this is about an advanced level. This is not about a particular job role or job title. Mm-hmm. There may be some consultant nurses or midwives who are working at an advanced level and can demonstrate as well. So as I say, this is about that level. It'll be those standards of proficiency that will be the key for individuals to be able to demonstrate that they meet those standards. We haven't got those yet. We may have some ideas because of the conversations that we've had around the principles about what they should look like, but we need you all to help us co-produce and shape what they need to look like for clinical practice, for other types of practice, so that we make them future-proof and robust and what they need to be. So, yeah, keep engaging with us.
Absolutely. And a question that has come up actually in different guises a couple of times really is about differentiation between the different, you know, within advanced practice, you've got advanced practice, you've got consultant practice. So do we have any intention of doing further work on the different levels within that?
Yeah, there's been a lot of work done, particularly by the Royal College of Nursing around the different levels of practice. And I think they're pretty well established in terms of kind of being accepted and adopted across the sector. This work is specifically focused on advanced level. Now, as Kay says, you know, this is an iterative process. Things change all the time. It may be that in the future we need to look at consultant level practice, but at the moment this is about advanced practice. So, yeah. Do you want to add anything else?
No, I think that's absolutely right. Yeah, thank you.
Thank you. And then there's another question on revalidation and advanced practice, which is quite interesting and something we are considering. So will advanced practice be reflected in the revalidation process is the question.
So we hope so. Yes. And that's why, you know, Aditi and colleagues have been leading and setting up the work for the review of revalidation in the code. But it really is about ensuring that public protection and making sure, as I said earlier, that individual practitioners are demonstrating that ongoing capability and competence, which would suggest that advanced practice is part of revalidation and people needing to demonstrate that. And that may be as part of thinking about scopes of practice, but in the future, it's in all likelihood there will be some considerations around advanced level practice. Yes.
Absolutely. And in the same vein, I will say that we will continue to engage with yourselves and other advanced level practitioners or those stakeholders in this space, because we want to keep that strand of advanced practice quite strong within both the code and revalidation review. So even considering, are there bits within the code review that we need to consider specifically from the perspective of advanced level practitioners? So we will keep that going. A question now on the multidisciplinary piece. So this is an interesting question, and they've asked is there any scope or intention to bring in regulation of advanced practitioners from other backgrounds or professions? So someone who might be registered with HCPC, for example. Is there a potential that we might look at them as being associate members or an additional register of sorts? Is that on the horizon?
Yeah, it's an interesting question, and I think we continue to engage with the other professional regulators as we said, and we had really hoped to create a cross-regulatory set of principles. But the other professional regulators, you use the example of HCPC, Aditi, have put out a statement and made it clear that for the moment they are not looking at additional regulation. Now, we are the Nursing and Midwifery Council, so our mandate, the evidence that we took to was the Nursing Midwifery Council. So we are developing additional regulation for nursing and midwifery professionals, but that's not to say that others won't do something in this space going forward. So I think it's really probably a watch this space. I don't think our legislation wouldn't allow us to have other professionals on our register as associate members.
I think it's worth also saying though, Aditi, that we are intentionally very open about this. We are communicating what we're doing very widely. There is a lot of multi-professional discussion continuing to go on, because actually it's really important not to be siloed about the work that we're doing, so that if people wanted to utilize this work, if employers want to utilize this work to think about this in the lens of what they do around advanced practice, then a lot of our principles are not specific entirely in that way. They could be applied generally across the board to the concept of advanced practice. So whilst we're not saying there's anything that we're associating this with any other regulatory body, what we are saying is, here's what we're doing, please feel free to share. And similarly, we're actively encouraging them to share anything they're doing with us.
Fully agree, and point really well made, that the intent and the ambition behind these principles has always been about multi-professional learning and working. So actually this is an appeal to everyone on this webinar. As employers, it is within your gift to promote these principles and make them your own. You can use this as a basis to have those conversations on how governance processes, how clinical supervision can work across different professions. So it doesn't have to be just about nurses and midwives. The principles have been developed by us, but by all means, it can be used in that and viewed from that lens. So we do hope that, we can address that point as well through these principles. There are a number of questions on transition. So I wonder if we want to just provide a quick few lines, Paula, on generally where we are with transition, because lots of people have asked about how we'll be considering, existing qualifications, whether SCIFN and SPQ will be recognized, for example, etc., digital badges, etc. So can we have a few lines just to clarify that bit, please?
Yeah, and this is a really complex piece of work, which is why it's kind of going from now and has been all the way along, because it's complex for a number of reasons. We heard loud and clear throughout phase one that professionals have already been through a number of quality assurance processes. And I mentioned, credentialing potentially with the Centre for Advancing Practice in England, but also some of the other Royal Colleges. The Royal College of Nursing has a credentialing process. So some of the options that we will be looking at and thinking about what they might mean is, if you've already been through a credentialing process, what does that look like? And would that then demonstrate that you meet our standards of proficiency? Now, it's a bit of a catch-22 because we don't have the standards of proficiency yet. But when we have those standards of proficiency, we will be considering those options like credentialing. If you've done an MSc through an accredited university in England, how do those kind of standards map to our standards of proficiency? So I hope that helps. We have got a number of options. We would like to engage with people over the next 12 months. So we'll be holding a number of roundtables again, as we always do, to continue these conversations. So really welcome you joining those conversations and really challenging us on our approach and thinking about other potential options as well.
Absolutely. Thanks, Paula. I think that kind of summarizes the general sort of questions that we've had on transition. I think we may have time for one quick question because we're almost there. Oh, but we have time for a poll. So actually that might be the thing. So yes, we would like some feedback on how you felt today's webinar went. We are very happy to come along and speak to groups, or if you've got any other suggestions for things that we might provide to you by way of support, we are here. We are listening. We want to work with you. So please do share your feedback and comments.
I think just to say, as well, as you continue to vote about this, one of the things that's quite important to us is that you do keep engaging, and that this is the beginning of our journey with some of this work. So the more we can engage, the better it will be. And I think we take some steer from you on whether you would like more information, whether you've got what you need. And as our work evolves, I think we will do more information giving sessions like these in order to take a sense of, I guess, the temperature of this work as we go along. I don't know if there's more to say, Paula.
Yeah, absolutely. I mean, the temperature, as you say, has been really important to us, as we've progressed various aspects of the work. And, if I think about midwifery and maternity services, we've done a lot of work having conversations with advanced practice midwives and sharing what that looks like. So there's a whole load of conversations recorded and posted on our website for people to have a look at.
Thank you. So we're going to bring this to a close now, and I just wanted to thank everybody for attending today, and hopefully gain a little insight into what we've been doing today. What we're intending to do going forward is to make sure that we provide some frequently asked questions to try and respond to questions that you've already heard here, but probably other questions that Aditi has taken down during the course of today. This is the beginning of everything. My big plea is, please contact us through advancedpractice@nmc-uk.org. Thank you so much for everything that you've done. Thanks also to the excellent presenters here and for the brilliant slides. And we hope to engage with you again soon.
Yeah, thank you, everyone.
Thank you very much.